Cancer is on the rise in America, and I think most of us are well aware of the screening that we're supposed to do. After the age of 45 or 50, everyone should get a screening colonoscopy for colorectal cancer. Women should get mammograms and pap smears. One thing that we may not be aware of are warning signs of sarcoma, and they're so rare that most people don't have to worry about this. However, if you do see a growing lump or bump on your arms or your legs or your abdomen or chest, and if it's growing rapidly, sometimes these are painless, I urge you to see a medical professional. Generally, these tumors are not aggressive and they don't usually require systemic therapy or chemotherapy. The key thing is to not ignore signs and symptoms that may be concerning. It's always better to talk to an expert and not avoid these questions. Time is of the essence when it comes to cancer of any kind. The earlier you find it, your outcomes are way better, your treatments are much less intense. And so I really urge everyone with warning signs that are related to a growing lump or mass, growing changes in the skin, weight loss, fatigue, any of these could be warning signs that something else serious could be going on. We all want to be vigilant for ourselves and for our friends and family. And so one key part of that is screening. And the screening guidelines really address the more common cancers. And some of these are cancers that increase with age, cancers that may increase with smoking or alcohol. Well, one thing to be aware of is that sarcomas really have nothing to do with your diet, with your age, smoking, drinking. These can affect anyone. They can affect someone who's otherwise totally healthy. Sometimes patients have advanced sarcomas and they actually feel quite well. And so a few warning signs to remember is that sarcomas can occur anywhere in the body. A common place is in the limbs, where you may have a large painless growth that many patients may not address for a long time. And so it's important for people to be aware of these things, to not hesitate to see their primary care provider, to see a nurse practitioner, to see a dermatologist, whichever medical professional that you are comfortable with, that you can see regularly. Reach out to them, trust their expertise, and trust them to get you to an expert if you need one.